Hello and welcome to ADEC's In Conversation, a special series addressing COVID and the impact on dying, death, and bereavement. I'm your series moderator, Dr. Jill Harrington, team leader for the special program and chair of ADEC's conference workshops. Today, our panel will address grief, bereavement, and death at a distance. We are very fortunate to have 6 multidisciplinary panelists joining us from around the country. They're all members of ADEC who are leaders in their field and will provide multiple perspectives on the impact of COVID-19 in their professional communities. So joining me here today is Dr. Phyllis Kosminsky, ADEC board president, private practitioner, and clinician at the Center for Hope in Darien, Connecticut. She's coming to us today here from Westchester, New York. We also have Dr. Patti, Anewalt, director of the Pathway Center of Grief and Loss, Hospice and Community Care from Lancaster, Pennsylvania. Dr. Tashel Bordere, assistant professor and extension specialist at the University of Missouri, Columbia. Chaplain Dr. Rick Forrest, coming to us from Norton's Children's Hospital. Becky Lomaka, director of grief support and education at O'Connor Mortuary in Orange County, California. And Dr. Bill Hoy, clinical professor of medical humanities at Baylor University in Waco, Texas, and ADEC treasurer. And Mr. Isaiah Allen, executive director of ADEC, coming to us from Minneapolis, Minnesota. I know Chaplain Dr. Forrest, I did not mention where you're from. I forgot to mention that. Can you tell us where Norton's Children's Hospital is located?
We're in the heart of Louisville, Kentucky.
Okay. Well, thank you all for joining us here today and taking time out of your very busy schedules. I know we've all been delivering services to the dying and the bereaved and those who are grieving many different losses associated to the COVID-19 pandemic. I wanted to start first with you, Dr. Kosminsky. Being in private practice, sort of like myself, you've seen a lot of different impacts to the community. I wanted to talk a little bit about, you think the biggest impact to practitioners has been?
Well, certainly speaking for myself and for a lot of people I know, the biggest impact has been obviously to have to transition to an online format. We're all used to sitting, face to face, and in some cases, knee to knee with people who are, grieving, people who are struggling with some very powerful emotions. And a big part of the support that we provide is the support that's transmitted through personal contact, right? One-on-one contact. And so to have to translate that into an online format is a challenge for all of us, and I think a challenge for our clients as well.
And getting up pretty fast on all the rules and regulations and
the
cans and can't do's.
Yes,
right?
No, that's very true. There are the technical aspects. The other part of it too is that a number of my clients have small children at home, have elderly parents in some cases who they're taking care of. So there's no such thing as having a quiet space for many of my clients, a private space, and that's a challenge as well. But what most people, I think, to a person, what people have said to me is, there's something that happens when you're in the room with someone, and and that's, I think, really what they miss the most.
Yeah, so it's hard to find sometimes for some people. They're challenged having like a safe holding environment,
right?
Putting that physical distance between them and the place at home. It's not often easy to find privacy. I know that on my end as a practitioner, one of the challenges I think some people may have if they don't have a home office is, protecting our clients' confidentiality, making sure we're here in private areas, but sometimes our clients don't always have the privacy to be able.
It's very true. So, in addition to obviously the stresses of the pandemic and the stresses of caring for other family members, a number of my clients have underlying health conditions, multiple sclerosis, diabetes, and so they're also extremely stressed, of course, about and concerned about, about those health challenges. So, I would say that, a lot of it, as it always is about, listening, getting a feel for where people are, offering realistic reassurance, realistic support without, minimizing the fears and the concerns that people have. So much of it is very much what we do day to day when people have problems that really there are no simple solutions for. And certainly those are the kinds of problems that people are faced with now.
Do you see anything in the community in terms of grief, bereavement? I could recently share that I had a client whose daughter died about 3 or 4 months ago, and the family had been looking forward to kind of gathering. I know we're going to address this a little later. For the first birthday came up, and they all wanted to go to the family grave together. Yes. And, she basically told me that they were all really holding back their strong grief emotions, the sadness, because no one wanted to cry because they all needed to physically distance from each other. So they didn't have the ability to run over and hug their aunt or hug their mother. And she really felt like she was suppressing her grief, but at the same time, very resilient and saying, I'm content with what I was able to do, but I do feel a little bit cheated. Out of all this.
The idea, that people are feeling cheated, I think is probably very widespread. People feel cheated in different ways. People feel cheated not being able to have happy celebrations, and people feel cheated not being able to honor the memory of people who they've lost. In my tradition, someone was asking me to just today, how are we supposed to sit Shiva? Normally when someone dies, a big part of how we, mark that and support one another is to sit together for 7 days. It's the core of our religious practice at times of loss. And to have to do that remotely just seems really, really strange and disconnected for people. So on the one hand, I think that people are absolutely adapting to the limitations that have been imposed upon them. And at the same time, they struggle with the feeling that something really big is missing. And that really big thing that's missing is personal contact. The ability, as you said, to hug one another, just to be in one another's presence.
But it's interesting that, and just one last issue I'm seeing is that it's interesting how people sometimes are able not to minimize it, but because everyone's going through it, it doesn't feel as personal to people.
Yeah.
It feels personal, but not the same. I don't want to speak for everybody, but that communal kind of response to.
Yeah, some of the responses that you get, are not necessarily what you would expect. I have some people who will say to me, if only my mom or my dad, was here, they would support me, it would be so much easier. And then I have other people, including my husband, whose mother died 2 months ago. And his feeling is he's glad that his mother's not here because she would be so frightened and it would be so difficult for her. So for some people, although it's difficult for them to not have their loved one present, there's also a sense of relief that particularly elderly parents don't have to deal with what's going on right now, Jill.
Thank you so much.
I was just going to ask a question, Phyllis. I'm wondering if, you were speaking about the kind of, through this video process of kind of stepping into the lives of people in a unique way that doesn't happen when you're able to see them in a clinical setting.
That's right.
And the challenges associated with that. I'm wondering if you're seeing the flip side of that coin, if it's opening up additional insight as you're providing care.
Well, it's
providing additional connection.
No, I mean, it's an interesting observation because, yeah, normally I don't get to see where people live, right? I don't get to know that somebody has a dog or that somebody has, 3 children under the age of 6 and, what that looks like for them on a day-to-day basis. So yeah, there is definitely that. And, I think also in this time where there is so much separation, I think they and I also feel a sense of relief just being able to lay eyes on each other. I had that conversation with someone just this morning that, yeah, we're sorry that we can't be in the room together, but it's just good to see you. It's just good to be able to see people.
There's a lot of adaptability going on with folks. People had never even thought they could do online therapy are really rising up to the challenge because the need to connect is there and to continue its services. So with that said, Patti, thank you so much. Thank you so much for your perspective, Phyllis, and all that you're doing. Patti, I wanted to ask you, what do you think some of the challenges have been for?
1 second.
Okay.
I'm gonna just, I realize I'm not plugged in and I don't want to lose power in the middle of talking. So bear with me. I was in my office today and came home, started working, forgot to plug in the power cord, and that's why I was disappearing while Phyllis was talking. So hang on, just the last thing I want to do is lose power in the middle of talking. There, okay.
So this is real-time stuff going on right now. Challenges of home working.
Yeah, yeah.
So what do you think some of the challenges have been for your hospice and how you all are adapting your how you're delivering services or adapting your services?
It's a good question. The important thing is that despite everything that's changed in all of our lives, we're still meeting patients and families. We're still serving them just in a very different way than we could have imagined. I mean, every day it seems to change. Our leadership meets daily with a couple of our doctors from 7:30 in the morning till sometimes 8, 9, or 10 o'clock, just figuring out how to negotiate the things that continue to change. I think the biggest thing that we worry about is staffing and staff morale. So far, you know, nobody is sick. So far, we haven't had a COVID patient, but we expect that's going to change as the numbers change on a daily basis. And our staff, they love their job, they need the money, but now with the COVID, they worry they're putting their own families in jeopardy, as well as the patients and families. They just really are scared. Some of them are anxious and tearful and, you know, struggle with concentration. They've got their own childcare issues. So, and we also, you know, we're working because we're an essential function. So we also, hospice survives on volunteers. You take the volunteers all out of the equation and all of a sudden there's a whole lot more work that the staff are doing that they've never done before. Volunteer coordinators that have never had direct patient contact are now doing that as they're doing laundry and greeting families that are coming in. And that's very stressful when they, you know, this is totally unfamiliar for them in their role. So we have formed a COVID team. So far, our hospitals, our inpatient unit tends to run like our hospital. So we're, you know, not full census right now, but we're gearing up for the fact that that's going to change. So we did form a COVID team that has an RN, an LPN, a chaplain, and a social worker, and they've agreed to work 24/7 to serve the COVID patients. And we do have other staff kind of who have volunteered to kind of be also available if we have to expand that. So, and the other interesting thing that I was just telling Isaiah before we started, this came up yesterday, that the Amish, they don't use media, they don't use the television, they kind of know about this, but they also, what do they go to 8th grade or something in their education? They don't understand science and biology, they don't understand how viruses are contracted, and they think this is all media related. They are downplaying it. There was a horse sale just a couple days ago in Lancaster County, lots and lots of Amish together. And the concern is that our staff are going into Amish homes to serve them because we're large and we always have done that. And they see lots of family all gathered around. These are big families. So the good thing is I'm on a child death review team for the county, and I contacted the person that connects with the Amish all the time to educate them about things. And she had come up with a COVID, she even literally draws pictures of Amish people because that's really important. It has to be of them from their culture. And she did, she's a public health nurse. So she did a great job of explaining how things get contracted. And we plan to roll that out and have staff bring that out to families, and they'll recognize this is her publication. And also do a mailing for all our Amish because we're concerned that that's gonna come out in the Amish population as well because they're not practicing any kind of social isolation. So those are some of the things going on with us.
That cultural component is so important, I guess, from community to community. And maybe Tashel is shaking her head. She can kind of, you know, add into the conversation a little bit later. But can I just ask you, Patti, can you just sort of tell us, the audience and us, the services you do deliver from your hospice and how you're delivering those services?
Well, that's been interesting. I was interested in hearing Phyllis's conversation about, you know, seeing people's homes and such, because, it's been kind of fun. I mean, I've offered virtual counseling for 3 years and probably had 2 sessions. Nobody seemed to want it. I couldn't understand that. I thought it was a cool idea, and we started to promote it and everything else. But now, when they're all home alone, a lot of our bereaved people, they're very open to it. We help them.
Yes.
All our groups are led by a master's level counselor, but co-facilitated by volunteers with the same type of loss. And they're all 17 of them. We're all on board saying we'll try. None of them knew Zoom before this, so we have been offering groups, and people are accepting that.
Online groups, Patti?
Online, yeah. I had planned a mindfulness series anyway. I've got 12 people registered for that are figuring out how to download on their phone or whatever. And the other interesting piece is that it does seem like people, you think about it, when people come to the Pathway Center, it's a huge transition to make that jump and go to a center for grief and loss. Here they're in their own comfort of their home. So we're finding that they're actually quite open and honest in their sharing, and the conversations are quite deep. So it's pretty neat to see that the positive side of this is it has opened up avenues that we may keep open in the future. I don't know. It's interesting.
Yeah, we may see a change in how people want to access their services now.
We do worry about PPE. That's the big concern. We have Amish people as well as a lot of our staff literally making masks and gowns, you know, so that as this surge continues, hopefully we'll be able to manage that. And the other, of course, we're a nonprofit. So our other worry is that, you know, will people's 401ks become 201ks and suddenly the donations will cut back? That's a big concern as well.
Right, good points. So are there any in-person services you're still delivering?
Absolutely not, nope. Actually, I'm on the local critical incident stress management team and on the executive board, and we had a meeting about that just this week as well. And it was interesting as we emailed the rest of the executive board, those of us that are over 60 had no interest in doing debriefings. It was a tragic situation that, you know, came up, and we realized, gosh, we better figure out how we're going to manage community tragedies. But those of us who were older thought we can do this virtually. The younger ones were saying, oh, we can do this with social distancing. They were open to it, but us older ones had decided, you know, I think we can do this through Zoom. So.
Thank you, Patti, so much. And it sounds like there's actually been, from what you're saying, maybe, and I don't know, that people are really, you know, accessing services, and you're delivering these services, and people are continuing with their care.
Well, the adults are. I'd say the children, we had just started our spring series of weekly family support, and we had the first week, and then all this happened. And we are starting meeting with the parents next week, but that's been slower to come. We're getting far fewer calls. I think parents are overwhelmed. They're dealing with mandatory school at home. They've got kids in the home. They're either having to work or they're trying to work from home. And either way, that doesn't work well with kids. So that's another whole category that we're a lot slower to figure out how we're going to manage.
Patti, I'm wondering, and I think this is a fairly unique role that you have among our panel here. If you can speak a little bit more to kind of how are you managing the staff that you have when it comes to their own self-care, their own
That's a good question.
Moderation of their own decision-making, of how they're going to, like you talked about yourself as a 6-year-old, making a decision about what's best for your health. How are you working with staff?
I'd say a cool thing that we're doing is that we have the person that's doing the mindfulness series with me. She has her training in MBSR, you know, mindfulness, stress-based. I forget what's MBSR stand for. Mindfulness-based
stress reduction.
Yeah, let's get that wrong. So she's offering twice a week, and they're also recorded, so staff can access them whenever they want, and they're encouraged to do that. We also have a frequently asked questions thing that that staff are openly raising all the questions about how things apply to them, and the leadership, even our president, because we don't have the volunteers to deliver the mail to our 3 locations. So our president I think the leadership's doing a terrific job of being visible and open and hearing people's concerns. And it's a juggling act trying to balance all that. Staff, you know, right now we're working, and we don't know if we can grant all the time off that they might need, but it's been, you know, conveyed that come later in the year when hopefully things are back on track, people can get cash options on their time off that they weren't able to use. So trying to think creatively as many ways as possible that, you know, the agency's trying to let staff know that we hear you, we have your back, we're so grateful for you. That's all we can do, because we need them too. It's tough.
Right. Yeah.
Thank you so much, Patti, and thank you and everyone who's working at your hospice to continue to provide this essential service. I know people are making decisions right now that are very difficult, not just for their clients or their patients or members of the community they serve, but for their own self and their own families.
Yeah.
And right now I'd like to turn to Dr. Tashel Bordere, who's out at University of Missouri in Columbia. Tashel, I know you've been, you're going to kind of give us a little bit of an academic perspective on being a professor and how this is affecting your students, how this is affecting your teaching, your research, but also you shared with us that you have an affected family member who's been fighting for his life right now with COVID-19, and also you're married to a spouse who's a first responder. So you know, we're also humans, and we have families and loved ones through all of this, and working through a lot of this with all that additional stress. So how has this been affecting you and your work?
It's, wow. I guess I want to start with the easier part, and maybe not. I guess I'll say this. I'm working from home with 2 kids, a 13-year-old and a 2-year-old. With a partner who's kind of leading the charge at our hospital with COVID and ICU, and really has been invoking all types of positive changes and making sure that they've been proactive. My brother and I guess I want to start with academics next, because my brother, I feel like I've been preparing everybody along this route, my children. And I want to say this too, the announcement came that our university was closing, and my university has been extremely proactive. They've been alerting us this entire time, trying to get us to be prepared to do online teaching and getting materials together and sending us resources. I have an incredible department chair, Brenda Lohman, and also Dean. They also have been doing like daily checks on, well, not daily checks, but actual calls and emails with faculty members. So they've been, you know, across the board trying to make sure that we're okay. Which is very important. I teach right now a large lecture class, Lifespan Development, in which we talk about gains and losses at each stage, despite the fact that losses aren't in their books. We talk about it at each stage of development. And so I had already established, fortunately, so I have 12 teaching assistants. It's a writing intensive class, and a teaching coordinator. So over 200 students, a teaching assistant, actually I have 9 teaching assistants and 1 teaching coordinator, TA coordinator. So a lot of different levels of people to take care of and make sure that they are first and foremost safe. Fortunately, I'm very student-centered in my approach. So I feel like I'd already established enough rapport and a sense of security to kind of move them through this process. They trust me in general, at least that's my impression. We got the announcement while actually I had a group of teens, a teenage panel in my classroom. We got this text message while these teenagers were talking about social media, that this was happening. The teens got it during the panel. My own daughter was on that panel. So it was like a group of 200 students who like came, not charging, but like it was interesting. So I was able to calm them at that point, talk about, give them a couple of initial steps, and kind of be very, very flexible and realistic in my expectations of them, for them online, starting with just a couple days to just take care of themselves before anything else would occur, that they get themselves situated, what they're gonna eat, how they're gonna get home, and transitional things, which they were very appreciative of. One of my favorite quotes is, people don't care how much you know until they know how much you care. So that was my first priority. And in a culture that is really built around fast movement, you know, capitalism, get back to work. And I don't care how many tools were sent to me. My biggest focus was the tool of security for our students, for my own children. I had my own daughter. So I had special meetings with teaching assistants just to do self-care and make sure that they were okay, make sure that they were clear on my expectations of them and the students. My My own daughter, who's 13, I took her through a process. Because she witnessed this whole experience, she's an 8th grader. I know adolescence is coming up, but I wanted to mention this really quickly because our kids are important in this whole process. So I'm a professor, but I'm a parent and a developmentalist. My daughter, who's the daughter of a thanatologist and a pulmonologist, wanted to go to school one more day just so she could experience her last day of lunch in the cafeteria as an 8th grader, her last day of, you know, seeing her teachers. And unfortunately, she was underrepresented. Her friends thought that she was like tripping, you know, like, we'll be back next week, these types of things. In any case, she experienced I hope that she will cope better because in her mind, she got to experience her last day of 8th grade before high school now. So again, I think helping people have these certain skills can help them be better able to cope with some of these experiences. So I feel like I've been trying to take care of everybody, give them the most optimal experiences. Again, I had to change I had to change paper assignments in my writing intensive class. They had an upcoming paper on sexual assault. So I've used reflections just to, for example, give them a chance to just first talk about COVID. What are you doing to prepare developmentally? Kind of a journal experience. I changed their sexual assault paper assignment to a different one because they're already stressed. Lots of flexibility. Working to account for kids who have developmental challenges, disabilities who won't be able to take the class in the same way. So I've been very sensitive to all of those people, to everybody's different needs. And then the situation occurs with my brother in New Orleans, where most of my family is, who was actually caring for my aging grandmother, which Phyllis mentioned. He was also helping my mother in the care of my grandmother, who is immobile. And he was diagnosed with COVID, spent several days in the hospital, started to improve, experienced a rapid decline, which they had expressed to us they had been seeing. Got a call in the middle of the night that he was being intubated and put on a ventilator. As you can imagine, this was pretty devastating and shocking. You can't enter hospital settings. So the notion that he was alone was very, very difficult, remains difficult. That my mom is taking care of my aging grandparent. And quite honestly, I love her. If you're watching this, mother, we call you, but it's a challenge. It does not come without challenges and her own frustrations and how to talk about this with her or not. So I've been, you know, kind of the social justice advocate and for everybody, my students, so it's the most immobilizing thing I've experienced in my life. And I've dealt with a lot to try to make sure that I still found ways for my mother in particular, who I'm worried about as much as my brother, to be able to still enter that space that we are now not allowed to enter right now. So I asked the doctor if we could speak to my brother, and she was kind of thrown off a little bit. And again, in fairness to doctors, their job is to keep people alive, not to foster all of these emotional relationships with families. So like many of us, where people are stepping into roles that they had not that they had not previously entered. She found a creative way to make that happen. And it actually was extremely comforting in terms of just anticipatory grief, honestly, around this. And
in what way?
We don't know what to expect, what's going to happen. We're bombarded with social media. I'm glued to it, even though I know better, because we are constantly learning new things, quite frankly. And my partner has, in fact, asked me to stop reading so much. I'm a researcher. To be quite frank with you, culturally speaking, as he was removed from the ventilator, he was experiencing delirium. And in my mind, and by the way, these medical staff have been phenomenal. Absolutely phenomenal. In fact, they upgraded me from a phone call to not doing these calls at all in their hospitals to doing Skype now. So I'm extremely excited about that. They were excited about it. So they've gone above and beyond. But I must say that you're waiting day by day for calls that may or may not happen. We didn't even learn he was intubated until like almost midnight. And that's like a huge milestone that we didn't hear about, that we had to call them because they're increasingly busy, in fairness to them. So it's scary. We don't know what to expect, and we're not there. The things you would learn at the bedside, you're not learning now. So I don't know. I'll just pause there. But
Tashel, what do you do for your own self-care? I mean, you're going through this as a family member, you're going through this as the spouse of a first responder, you're going through this as a mother, a teacher, a researcher, a thanatologist. What are you doing to kind of keep yourself going?
I don't know. To be honest with you, it's difficult to sleep, very difficult to sleep. But I have, actually, ironically, social media. When I knew that my mom was better, that was kind of self-care for me. I know that sounds kind of crazy, but when she was able to speak to my brother, and I know I felt incredibly better, like strangely better, even though he couldn't speak back or anything. Hear my mom say that night, without me saying it, how that was changed, how that she was going to go to sleep that night. Cause I don't know, it was just powerful. And then social media, I asked for prayers, and I asked for specific prayers specifically for him, not the cliches that we hear, not the I'll keep you in my thoughts and sending you love and light. I was like, no, I want like a prayers, and his name is Rod. And I don't know, that was very empowering for me for self-care, and people like literally still continue to say, and they want these updates. They still say, you know, I really prayed. I actually really prayed. Yeah. So people's respect and honor, and there's hashtags for him now. And that actually has kept me going. And I value it. And Kate was like, you don't have to go and tell everybody, single person, thank you. I'm like, no, I need to, because people took the time to read this and they're trying to be encouraging. So that was it. I honestly, that's been helpful for me. I've been spinning a little bit, although not true exercise, but just sitting on my bike and riding for 10, 20 minutes has helped some. Thanks for asking.
Sure. No, I mean, Isaiah, I saw your lips starting to move. You have a question for Tashel?
Well, I think, Tashel, the thing that I was hoping you'd speak to, and I think you did there a little bit, when you mentioned the tool of security, when you're talking about what you were doing for essentially everyone that you were caring for when all of this started to happen. And I think my question was, and just a different way of phrasing that than Jill did, and I know in the field we talk about the different tools that we have available to us, you know, for different settings. And I was just wondering if you could comment on, you know, in the midst of constant disorientation, right? Like we talk about how the news of yesterday is no longer relevant today.
Right.
In the midst of constant disorientation, how do we direct people to find security? like how can security be a tool when everything is turned on its head?
Some sense of predictability, quite frankly. Columbia, well, some sense of predictability, like knowing that I'll get to call him, I'll get to hear his voice. When that got shifted, I've been thrown off for 2 days now. You know, today has been especially hard, although yesterday was good. Making sure that my kids know that every day we're going to eat lunch at this certain time and we're going to go outside for a walk. So just still, my 2-year-old, I drove her past her school to show her that no cars are there. I promise you, all the kids are home now. That's what they're doing with their families. She needed to see it, right? They're concrete. So predictability, we can still take control of those kinds of things. And that's been security for a lot of people around me.
Some structure, some routine.
One other last quick thing is also making sure we're focused. We're not trying to pretend this isn't happening. That gives us a sense of control. I've literally been in meetings with people where I've had to say, listen, I know we're trying to still talk about like pizza, but actually can we send resources on COVID pizza out to people, right? So trying to help people shift from this, trying to do the same norm to like, this is our new norm. And this is how we have to change to like actually meet the need that's in front of us right now. So that kind of thing. Thanks for your questions.
One last question before we move on. How is it affecting, real briefly, how is it affecting your research at all? Or is it? I don't want to be presumptuous and ask that.
I'm able to still write and do data analysis and things like that. But it's different to write about like homicide laws right now in the midst of COVID. I felt some kind of guilt around that, you know. I'm working on a grant right now with regard to that. And some of my focus is on kind of formulating other questions about how teenagers are dealing with this right now. although we know they're interested in social media, they actually really are missing their friends. They actually are missing the face-to-face contact with their friends. And I think that would be a unique finding coming down the road. I want to talk to the nurses about their bereavement because they've been processing with me when I call about my brother. So it's like, no, I want to get this on record. Can we do an interview after this? So
I guess it's different when you're a teenager and you can electively socially distance or physically distance, we're going to talk to Phil about, rather than being forced to do it. So for your own safety. So thank you so much, Tashel. And we will be sending, I know I was one that was sending my prayers for your brother. So we'll continue the good thoughts and glad to hear that he's doing better. And all, you know, very much for you being a service out there to your students, as well as your partner who's delivering, you know, essential healthcare services. So with that said, I know we're going to talk to someone who's in a hospital himself right now. Dr. Rick Forrest, you're delivering services to patients who are actively dying, correct?
I am. Our challenge is to be present from a distance. Every time we walk into the hospital, we have to have our temperature taken and we're given a mask. And so we're trying to interact with people like this, just with eye contact and hearing their voices. We're also trying to preserve PPE. So we don't go into every patient's room, even if they don't have COVID. We're trying to save those kinds of resources for the people who go into the rooms with COVID patients. So we're being very mindful of how we care for patients, but also the patients' families, and of course the staff we encounter. In our particular hospital setting, we're part of a 5-hospital system in Louisville. 4 adult hospitals, and we're the only freestanding children's hospital in Kentucky. And so we as chaplains could be redeployed to any of the adult hospitals at any moment. So we have to be prepared to engage with staff, families, patients, wherever they might be, and try to be creative in how we do that. We're using a lot of iPads these days and things like Skype, FaceTime, Zoom, to get some kind of face-to-face interaction, even though it's distant. I kind of think we've been preparing for this for a long time in the relationships that we have built with the staff in our hospitals. In our children's hospital, our chaplains are deployed to particular units, even though they serve the entire hospital. I work a lot with our emergency room, with our neonatal intensive care, with our pediatric intensive care, and have built relationships through the past 17 years that come in really handy at a time like this, because you walk into the unit and you're familiar. Someone who has walked with them in bad times before and will be there again.
Can you describe some of the services as a chaplain that you deliver?
Well, mine's a unique position because I range through the hospital rather than have a particular unit. But that also means I serve all through Kentucky. Our primary service is all of Kentucky and 32 counties in southern Indiana. And I go to a lot of funerals, home visits, and other initiatives that we have that bring people together, which we can't do right now, to help them understand how we grieve, how we help each other as a support system as we grieve. I usually do about 15,000 miles a year. More if I have to go further, like last year, New Jersey, South Florida. And I'm having to adjust that now. I can't make those trips anymore. I have to do more through the phone, through visualization like Skype, like FaceTime, to provide support to these families, but also spend a lot more time in the hospital with staff, listening to them, walking with them in the midst of all of this, letting them know that they're not alone and that this is going to end. This is not forever.
Because you're also attending to the dying who, I mean, we're not only talking about people who are dying from COVID-19, and like Tashel said, she almost felt guilty saying that, you know, doing homicide research. I mean, people, life and death is happening in the midst of COVID-19. So you're delivering services to all those who are dying in general.
My day began at 7 in the morning in the emergency room with a 3-month-old who died.
Mm.
We don't know yet if that 3-month-old had COVID or not. My day ended at about 7 o'clock last night with a 9-year-old who was pronounced brain dead, and we're looking at the possibility of organ donation.
Mm.
All these things are happening in the midst of COVID. We've had some COVID patients in our hospital, and we have a part of one unit that we recently renovated set up as a COVID unit because of the isolation available in those rooms and the new ventilation system for those rooms. So that's dedicated. We're set up for that.
Mm-hmm.
But we've not seen many COVID patients at our hospital, but we have had them in our adult facilities.
Okay. But you're still attending. I mean, people have to realize that, you know, life and death is happening now in the midst of COVID, not just from COVID. And so delivery of services have really changed in end of life care right now, or have they? I mean, can you tell us a little bit about the changes that?
Yes, we're having to restrict the number of visitors who come into a patient's room, into the hospital in general.
Mm-hmm.
So we can't have those large families gathering at the bedside of a child who's dying.
Mm.
It's just not something we're able to do because our governor has said, can't do it, don't do it. And we understand that, and so we try to be sensitive to families and find creative ways to help those kind of things happen too. That's where the iPads come in handy. That's where other kinds of media come in handy. But we try to process families through as best we can, given the restrictions under which we work.
What do you think, and last question, what do you think some of the issues facing your staff are at this time?
Well, Tashel spoke to one of those issues, that of isolation, that of just not being able to have people in the room with patients. Usually there's maybe one, at most 2 nurses going to any particular patient's room at a time. But the other issue is that of the ambiguity of all of this. With many diseases, we have a trajectory. We know that on day 2, you might feel this, on day 5, you might feel this, and day 6, you'll feel better. We don't know about this. And there's the ambiguity of how long we will be at lockdown, how long we'll have to isolate, and frankly, we don't deal with ambiguity very well.
Right.
And so we continue to be there in support of our patients, our families, our staff, at the same time taking care of ourselves and each other for the long haul.
We're learning as we're living through this, which is a part of, we're used to reading this in history books or sort of pre-industrial, you know, the pre-industrial world. So we're learning about this as we're living through it. And we're, you know, learning about the disease and how to care for people and the science behind it and the medical care behind it. So that all that ambiguity, people are really just stepping up to the plate and trying to do the best they can under these circumstances, but also provide the best services they can in the best way we can.
So, I'm wondering, Rick, in your observation of replacing the human presence of when I think of chaplaincy, and I think of even what Phyllis had mentioned about sitting Shiva within her tradition, you know, as you're replacing that electronically, have you noticed anything that you would say is particularly effective in that process, or maybe things where you're like, oh, these are things I would stay clear from in trying to bring something of presence electronically?
I think with the electronics, we're able to record video, record audio of these families. So there's a legacy that can go on if the patient is going to be dying. We can preserve some of that. But as you know, as we can see, just by looking at each other, it's kind of hard to communicate sometimes like this. And some of the cues we normally have aren't there anymore, particularly if we're having to be gowned, gloved, and masked at all times in a patient's room. So Yeah, this is a hard time, and it forces us to find new ways to be with each other and for each other.
I think you said it, like forcing us to find new ways as this is happening. And this is something we're really not, that ambiguity of it is something we're not used to. And I want to thank you for sharing what you're doing with all of us. And now turn to Becky Lomaka, who's out at O'Connor Mortuary in Orange County, California. And you're directly working in funeral services. What are some of the misconceptions, Becky, about funerals during the COVID-19 pandemic? There's a lot going around out there.
There is. I think I've filled so many calls, emails about, oh my gosh, I hear funerals aren't happening anymore, and oh my gosh, what are people doing when there are no funerals? And that is the biggest misconception. Funerals are happening, ceremonies are happening, gatherings are happening. They just look very different than they looked a few weeks ago.
What do they look like?
Well, they look a lot like this. They look a lot like this. Most funeral homes are doing very small gatherings. It's the 10 or fewer people with the proper 6 foot of physical distancing between. And then again, most funeral homes are offering free live streaming for families who cannot be physically, and friends who cannot be physically there. We've even talked with firms across the United States who have seen parking lot funerals. So the 6 or 8 people who are actually able to be in for the ceremony are there, and friends and family are in their cars. They're isolated. They're practicing proper distancing. That they're staying in their cars. They're watching it via live stream, and then when the family comes out, they're turning on their headlights as a symbol to them. A lot of video messaging. I mean, things that you wouldn't think about, like a guest book. Those aren't happening anymore. And so that virtual guest book, the ability to all gather, maybe to have the hearse drive by the person's favorite restaurant. And letting the family know, here's the path that we took to get from point A to point B. So it's been very important for us. People writing messages, and then the funeral home having those messages handwritten and in the chapel of the funeral home when the family comes in. It's been so important for families to have that connection. And what we're really seeing is families, the grieving families. I love this phrase of, clarity in the midst of uncertainty. We're continuing to do what we have always done, coming along beside grieving families. And now we're seeing so many aspects of their grief. They're grieving the loss of the death of their loved one. They're grieving the loss of the ritual that they're no longer able to have. I mean, Phyllis talked about sitting Shiva, and then so many things that lead up to the actual ceremony. They're grieving the loss of not being able to be at the hospital with their loved one. So we're kind of that last line where people can come in, they can actually physically see their person, they can spend time with their person, and that has been so valuable to families.
How are funeral professionals coping and practicing kind of good self-care at this time?
It's been tough. A lot of the same things that we've talked about. I think one of the things for funeral professionals is, as a profession, they feel very disenfranchised. We see the thank yous to the first responders, the thank yous to the truckers, the thank yous to the grocery store clerks. And through all of this, time and time again with my team, with other funeral directors I've talked to across the United States and Canada, what about the funeral people? We're that last line, the last responder. We're coming in, we're caring for the families like we always have. And is anybody seeing what we're doing? And really that's a bit of anxiety. We want to care for this family to the best of our ability, yet there is also some concern and trepidation. And, you know, am I going to get this? Am I going to bring this back to my children, to my family? So practicing a lot of good self-care. We started some breathwork virtual classes at our funeral home. We kind of start out our day with that to help everybody kind of just take a moment, pause, relax a minute before their day gets going, and really just being there for one another, letting everyone know, hey, if I need a pause right now, I need to refill, I need to replenish, give me 15 minutes, and then I'm going to be ready to go again.
Wow. So, I mean, how are funeral professionals guiding families who are not only, I mean, you mentioned a lot, they're doing so much, as you said, and sort of end of the line services for our families, and they're not only grieving the death of their loved one, they're grieving, I mean, families are grieving so many losses, especially that of funeral rites and the rituals. I know Dr. Hoy's going to address this a little bit as well too, but it also, it sounds like from what you said though, kind of showing the resilience of the human spirit, really coming up with creative ways to honor and remember and memorialize their loved ones. Absolutely.
I think more than ever, because people are not able to be with their dying family members and friends, they're realizing that need for human connection and how important that is. You know, Bill and I were just talking earlier today that it's also reminding families to take a deep breath and slow down just for a minute. And there is so much anxiety, you know, the lack of communication, because the hospital staff have other priorities to do, and there isn't always that line of communication. So when they're calling, they're so anxious, and saying to them, take a deep breath, and we can do this. Just like there's no timeline with grief, there's no timeline with ceremony either. It doesn't mean that because we can only have 10 people present right now, that when the time comes, we can't have the ceremony that has 100 or 200 people there. And let's talk with you about what that can look like. And when we don't know when that can happen, but we know it can happen in the future. So really focusing with families on what we can do during this time to help ease their anxiety.
That's a real hard shift. And Dr. Hoy, I wonder if you can kind of address this too. We're so, you know, our rites and our rituals and how we grow up in sometimes our faith communities, they're really, you know, a lot of people, they're embedded within us, and they're part of us, and they, you know, it helps us to honor life and both honor death. So, you know, people have really had to make that fast switch right away. How do you think people are doing with that?
I think people are having a tough time of it. Just as we're expressing here, I think all of us are kind of trying to find our way hour by hour, and I think families are struggling. I don't think there's any question. I think what Becky was pointing out a minute ago is really accurate. Folks are coming with lots of anxiety. There is so much, for lack of a better term, I'm just calling it environmental anxiety right now. There's just so much anxiety that's sort of free floating in the etherish, as it were. And I think the more people are on social media, where facts are not always facts, and the more of that goes on, the higher the anxiety seems to go. So I think all of those pieces are kind of coming together, and I don't think any of us know what this is going to look like in terms of complicated grief in 6 months, a year, and 5 years from now. But what I said in a seminar this afternoon is I'm pretty sure that I'm pretty sure, this is just my opinion, but I'm pretty sure that the complicated grief that will come out of this will be something that will still be reverberating when many of us in this on this call this afternoon will be long since retired. This is not going to be resolved next year. This is going to reverberate, I would imagine, for several decades and probably into the next generation.
Well, I mean, we don't know because we haven't seen this, and we're not able to. People are 2 or 3 months into, you know, grieving the death of a loved one, and, you know, we just don't know what some of those complications may be.
I think Yeah, I think that's true that we don't know. I think we have good evidence from other episodes that we've seen. And I think the continuing, and Tashel could probably speak to this better than me, but the continuing reverberation of the grief and trauma out of Katrina that happened 15 years ago. And boy, when I grew up in Baton Rouge, so when I'm back in that part of the country, I can still feel it. And it's been 15 years, and we're not talking about 240,000 deaths, which is now what I believe our current projection in the U.S. and around the world. So I think we don't know how bad it's going to be, but I think we would be kidding ourselves to not think it's going to be significant, and especially without the role of these stabilizing rituals. Now, that being said, I think it's also important that we not contribute to that anxiety by continuing to populate things that are terrible about this. And you know, one of the things that I've been saying recently is the importance of making sure that we are data driven. You know, I'm a scientist, and I want to make sure that we're handling the data correctly, and it is important that we put this in perspective. If we have 240,000 deaths, that will increase deaths in the United States by 8% this year. And I think that's frightening when we call it 240,000. And for the 240,000 families involved, it is very significant. But we also have 700 and some odd thousand deaths by heart disease every year in the United States. And we have over 100,000 accidental deaths every year in the United States. So I do think it's important that we keep these things in context.
What do you think some of the spiritual issues people are having are now?
Yeah, well, I think one of the things that I've observed is that the lack of the presence of a beating heart in the room with me is a very big lack. I heard that from Rick. I heard that from Becky. I've heard that from Tashel. I've heard that from Patti, and I've heard that from Phyllis. In other words, all the way around this room, this virtual room, I've heard the same thing echoed over and over again. And I think that is a spiritual construct. Basically every religious community on the face of the planet is interested in connection. And that connection typically is embodied connection. And I think the fact that faith communities are trying to figure out how to do things virtually is admirable, but I think what we realize is it's not the same. And I was just telling Becky in a conversation this afternoon, actually, it was funny, I polled my students yesterday because like every other university, Baylor is now completely online. And in our undergraduate program, we don't do online education. We've been categorically and philosophically opposed to it, to be completely honest. And I polled my students yesterday, 58 of them, and I said in different contexts, and I said, so I'm curious, now you could go do a degree completion program at any number of universities in America for 1/3 of what it's costing you to come to Baylor. How many of you are about to sign up for that? And not a single hand went up in the room. And these are people who were born with an iPhone in their hands. So I'm thinking we are discovering something different about the human ethos, and that's a spiritual construct, that we need physical connection in ways we didn't even think we would 6 weeks ago.
I know a lot of my own students, I adjunct a class, and they have their own anxieties about what school is going to look like in the fall. You know, what is school going to look like? Is it going to continue to look like the virtual environment that it is, or is it going to continue to look like, you know, they're going to be able to return back to class? So I think education, as we know, it's going to be making a shift. What do you think also, what's going to be shifting for people in terms of what you like to not call social distancing? You recently wrote a paper and you preferred the term physical distancing. I mean, I often am working with my own clients and students who feel like, you know, it's going to be a reintegration process, that people are not going to just go back to all of a sudden being physically present with everybody. So how do you think that adjustment's is affecting people? And you recently wrote this paper on the term, you know, trading the term social distancing for physical distancing. Why do you think that distinction is kind of important?
Yeah, well, so I think physical distancing is a way to say the same thing, and that is that we're really interested in how do we create physical space between us that keeps us safe. But I think the term social distancing, one of the problems with it is it implies isolation, and I don't want us to be isolated. We do not need to be socially distant from each other. We need to be physically distant from each other. The World Health Organization's picked up on that. I don't think they got the idea from me. There have been several people that have been playing around with this terminology, sort of independent of each other. But the World Health Organization actually picked this up. In fact, I have a news release that came out from the WHO just a few days ago in which they are officially changing their terminology to say physical distancing rather than social distancing. Now, CDC and NIH haven't joined the party yet, but they've got bigger fish to fry probably than thinking about terminology right now.
So why do you think, though, that distinction is important? Because, I mean, I got pushback from a lot of people in my own family or friends, you know, saying, you know, it's all about social distancing. And it's really not really about social distancing. It's about physical distancing.
Yeah, it's physical distancing. That's all we want. We do not want to be distant socially. And I don't think anybody wants to be socially distant. In fact, in many ways, Westerners have been so distant all along. If anything, we need to return to a social connection, but stress physical distance. The virus is not transmitted across this screen.
Right.
The virus is transmitted in physical proximity to one another. So, and again, I think, I'm finding all kinds of concerns that are simply not founded in the science as we know it. Now, I recognize that some of this is changing, but some of this hasn't changed. And what we know is that you can't catch it from talking to someone on the phone. And we know that's true because viruses don't get transmitted that way. So I think we want to be socially connected and physically distant. That's why I think the distinction is important.
Right, right. We don't want to, when people are physically distant, we don't want them disconnecting with each other. You know, we
probably need more social connection if we're not going to be. And I love what Becky was talking about. You know, we need to have funeral processions where we drive past the places that were important to the deceased. We need to have funeral processions where our whole community follows in their own car and comes to the cemetery or comes to the crematory and wait in their car if they need to, but they are present socially with these folks, even if they're more than 6 feet apart and they're not gathered. And that follows the rules and keeps everybody safe.
Thank you. Thank you all so much for sharing your perspectives from the multiple communities that you work in professionally and the communities you serve. I wanted to kind of open it up now that you've all heard each other to maybe ask questions of each other of right now, any questions you have for one another, the things we've talked about tonight.
This isn't so much a question as it is just a comment about spiritual connections. A number of my clients, and one who I spoke to this morning, said that she now is part of a virtual Bible study class, a virtual choral rehearsal, virtual attendance at services. So I think a lot of people are finding ways to maintain those connections as well. And I think that we've become, I know I have become, and I think a lot of people I've spoken to have become much more intentional about staying in touch with people. I think a lot of times we think, well, I should call this one, I should call that one. But lately in my life, I find myself being much more deliberate and making sure that certain people, that I'm in touch with them. And by the same token, the people who call me to check in with me, I'm just deeply grateful to them for thinking of me and reaching out in that way. So I think in some ways I feel more social connection than I have in some time, even though I'm physically distant. So it's very significant for me.
And that's exhausting people as well, because we're talking to people we don't normally, in our own family, we do virtual bingo every Sunday night. It's not something we do get all, family members from around the country to play bingo. And we love it, but at the same time, I think you're right. People are socially connecting in ways that they haven't done before, and with the volume they haven't done before.
Well, sure, because I mean, it had been that we might get together with, 6 or 7 people in a room and go out to dinner and do this and that. We're not doing that. A lot of the communications that we have with people are one-on-one, individual. So what might have been a group get together now becomes 5 or 6, 45-minute conversations. And yeah, it can be a lot.
Jill, one common thread I heard from all of us as we were each touching on self-care in our various professions, our various lines of work, is, I think one thing that is helping all of us with self-care is the fact that we are still serving. We have a new normal, yet we are still serving, and being able to help those who need our help is, and knowing our purpose is really great self-care for all of us.
Yeah, very meaningful. I mean, some people have said to me even that you're able to continue. I mean, my work has increased in terms of mental health care and my teaching responsibilities, and, being able to hold on to a little bit of that normalcy and be able to, have that making meaning during all of this and feeling productive. And helping those who are grieving and who are dealing with uncertainty, or, who need a little bit of, coping mechanisms. And so I think that's a great point you bring up, Becky. That is kind of our own self-care. Patti?
I also am finding the importance of figuring out boundaries, personal boundaries. I tend to work a lot. So I literally, when the weather's nice, I walk the dog in the middle of the day, or I made homemade bread yesterday. I mean, so I'm doing things and I'm being more intentional in that regard, because I'm finding otherwise, like you say, I think we're all finding, I don't understand how I'm not commuting 2 hours a day to work, and I'm busier than I was before. And I think it's just because we're doing everything electronically. So we're all inundated with more emails than we're used to. And it's harder, I'm finding it harder to prioritize. I have to work harder to prioritize for some reason. So I'm still figuring that out, but I think that's another part of the self-care challenge, is figuring out those boundaries. Like it's 6:30, it's 7, 8 o'clock at night, and we're still working.
Right. I was about to say. But, yeah, and we don't normally have the normal. I mean, some of us who are recovering workaholics are still workaholics. It's we don't have the same outlets that we did before. So, I was just talking to Phyllis about one thing. I enjoy going to lobster night at my local restaurant every Wednesday. I look forward to that every week, and it's just not the same here at home. So we have to actually think about the things we're doing for self-care. We have to create new ways, but they're not really ways that sometimes can meet our energy level, or what kind of feeds our soul, or, replenishes us. And I think there's a canine conspiracy going on through all this, because my dog has never gotten more attention.
Yes.
I will be a conspiracy theorist in that. My dog is, but, more walks with the dog. But trying to find those ways to provide good self-care for ourselves. We really have to think about it. It's not coming naturally, at least to me. Anyone else?
I think one other thing I wanted to say is, I'm sorry.
No, I said, anyone else have any comments?
Yeah, I just wanted to say that also being open to receive right now, because we give so much. And again, just witnessing those hospital staff do extra when they weren't used to calls at all, like stepping outside of their comfort zone. That was like a sort of healing, extra healing, and more sense of community, feeling less alone in this endeavor, because now I can count, other families can now count on calls that they wouldn't have probably, maybe somebody would have asked eventually. And then also just being open, again, going back to the Facebook post, I put that out for my brother, and yet it ended up being empowering for me. Like I was like thinking, oh my, they really took the time to write a real prayer in here, not even just say it. And people's intentionalities, being able to witness that and receive that. I can't imagine in your discussions, meetings with clients, that you are, as you listen to strategies that they're using, you can't help but like think about how that might, you might mirror that in your own lives as we hear their strategies. So I'm also just being able to receive has been the way that I've been able to fill my cup up in this process.
Well said.
That's great.
Well, Jill, I think this is pretty cool how this all fit together. I think it all kind of one fed into the other and it all tied in very nicely. It was pretty neat how you put this together.
Well, I want to thank you all. Thank you, Patti, and thank you everybody for joining us here tonight in our special series of ADEC in Conversation. I want to thank you for lending your time. Thank you, Patti. Thank you, Isaiah. Thank you, Bill. Thank you, Tashel. Thank you, Rick. Thank you, Becky, and thank you, Phyllis, for lending your expertise and your experiences to the impact to yourself and your communities, as COVID is unfolding. And I want to tell everyone who's listening here tonight to be sure to check out other interviews that are upcoming in the series, and they'll be posted on our ADEC website as they're recorded and happening. And to also all of you who are watching, be well, stay safe, and if you're not an essential worker, we hope you're practicing safe social distancing. So on behalf of ADEC, good night, and thank you all very much.
Thank you.
Thank you.
Thank you.